In this section, we're going to review blood administration policies and procedures at Centra Health. When you receive an order for blood, you need to know the steps to take. First, you need to verify the provider's order. Make sure that you check what the patient is to receive and the number of units they're supposed to get. Provide the patient with the blood education pamphlet, review it, and document that they received it and it was reviewed with them. Make sure that the patient understands the signs and symptoms of a reaction. Make sure that consent has been obtained. Informed consent is the responsibility of the provider. You need to make sure that it's done and that it is on the chart, but if it is not complete, the provider has to physically come up to get the blood consent. You cannot do it over the phone. Consent for blood administration is obtained from the patient or their legal guardian. The provider is responsible for obtaining that informed consent. The provider must review the risks and benefits of the blood with the patient or the legal guardian and document it. When the RN or LPN signs as a witness, it is stating that you are witnessing the provider reviewed the administration risks and benefits with the patient. You're not signing that they necessarily understood. You're signing that it was gone over and they were given the opportunity to ask questions and that you witnessed them signing that consent. Most blood products do require consent. This includes leukocyte-reduced red cells, plasma, platelets, cryoprecipitate, Rh immune globulin, and IVIG. If you are giving any of those, you need to make sure that there is a signed consent on the chart before you administer it. There are a couple of blood products that do not require consent. These are dispensed from pharmacy. This includes your plasma protein fraction, or PPF, and normal serum albumin. There are two different types of consent for blood administration. The first we're going to talk about is the consent to operation or procedure. This is the consent form that is done with a provider and the patient prior to a surgery or a procedure. This is only good for the duration of the surgery or procedure and through their stay in PACU. If they agree to receive a blood transfusion on this consent, it's saying that they are agreeing to receive that transfusion of blood or blood products if deemed necessary during or after the procedure. If the provider does not feel that this question is applicable, there is a not applicable box on the form next to blood products that the provider can check. There's also an option on there to refuse blood products. This is going to have the patient sign that they are refusing blood products under any and all circumstances, including death. These types of consents are valid for 30 days after signed by the patient. They are usually completed if it is a scheduled procedure during their pre-op check-in. The second type of consent is consent for administration of blood or blood products. This is what most of you are going to be working with. This has to be obtained by the practitioner if the patient is going to receive blood after being discharged from PACU. This can be found in forms in Cerner. The form number is right here. You don't need to memorize it. If you just search for blood consent, it'll come up for you. Practitioners need to obtain the consent for administration of blood or blood products in addition to the consent for operation or procedure if they anticipate that blood could be needed during the patient's hospital stay outside of the PACU. This type of consent is valid for the duration of the hospital stay. So if I'm hospitalized for a month and a half and I signed this consent on day 1, it is good for that entire month and a half. This is what that consent form looks like. You can see there are 2 spots for the patient initials. Then at the bottom, there is a date, a time, the patient's signature or person authorized to consent for the patient, the provider's signature, and the witness's signature. If the patient refuses blood products, there is a blood refusal section on the form. Please make sure that you complete that section. You can see the refusal of consent for transfusion circled on this form right here. They would initial on that patient initial section underneath there. Says I refuse to consent to the transfusion of any blood or blood products. If known, state the reason for refusal. So please write on that line what the reason for refusal is if it's known. If you are getting ready to give blood and you're checking to make sure that the consent form is signed and on the chart, please make sure that they initialed in the correct spot. It does happen sometimes that people accidentally initial under refusal of consent instead of consent for transfusion. Please make sure that they've initialed in the correct spot before you give blood. The third way consent can be obtained is for emergency blood release. This is initiated by the physician. They will contact the blood bank. The emergency blood released form is sent electronically to the physician by the blood bank. For administering emergency blood that has been released emergently, you need to refer to the emergency release of uncross-matched blood policy. In the event of an emergency situation requiring transfusion of blood or blood components, then the patient is unable to give consent. Consent from the legal guardian should be attempted. If consent cannot be obtained, it needs to be clearly documented in the patient's medical record the emergent nature of the transfusion and any steps taken to locate a legal guardian. When preparing to give blood, you need to verify or establish an 18 or 20 gauge IV site. This is going to be prior to obtaining the blood product. Please confirm that the blood bank bracelet is legible and on the patient. You need to take vital signs within 30 minutes prior to starting the transfusion. If your patient's temperature is greater than 38 degrees Celsius on pre-transfusion vital signs, you need to notify the physician before obtaining blood from the blood bank and get their okay to administer the blood anyway. You need to gather your supplies. This is going to include normal saline, Y blood tubing, it's that filter tubing. Refer to the chart within the policy for the amount of time that the tubing is good. If you are transfusing 2 types of blood products, the tubing needs to be changed for each type of product. And then you want to get an IV pump if needed. Then you will request the blood product from blood bank using the blood bank bracelet ID. A transfusion report will come with the blood. Do not remove the transfusion report from the unit. That record has to remain attached to the unit until it is completely transfused. That is the only indicator on that unit with your patient's identifying information on it. It is vitally important that that form stays on your blood until the transfusion is complete. If we are in downtime and you cannot document in Bridge, this form is your downtime record. If you use this as a downtime form, the original has to be returned to blood bank for documentation purposes. If you do not use this form, if you are not in downtime, the form does not need to be returned. It can be placed in the shredder box after the blood is administered. If you notice any of those things in your blood product, please return the product to blood bank. Do not administer it to your patient. Bedside verification must be completed with 2 healthcare providers. This can be an RN and an MD, an RN and an RN, or an RN and an LPN. First, you will ask the patient to verbally state their full name and their date of birth. If the patient is unable to state their name and date of birth, then you must have your fellow medical professional, RN, MD, or LPN, verify and verbally state the patient name and date of birth from their hospital armband. Next, you need to check the patient's name against their hospital armband, the transfusion report, and the blood bank armband. Then you need to confirm that the MRN or FIN number, whichever is on the blood bank armband, matches the hospital armband and the transfusion report. Then you need to make sure that the blood bank ID matches the transfusion report attached to the unit to be infused. From there, you need to check the blood type on the unit against the blood type on the transfusion record and the patient's blood type on the transfusion report. Then you need to check the unit number against the unit number on the transfusion report. Check the expiration date on the unit against the expiration date on the transfusion report, and verify the compatibility on the transfusion report. This should all be done using closed loop communication. So the first verifier will say, patient's blood bank ID is 1, 2, 3, 4, 5, 6. The second verifier will say, patient's blood bank ID is 1, 2, 3, 4, 5, 6. And then the first one will say, that's correct. It's going to feel very tedious and silly as you're doing it, but it is vitally important that you hit all of those points using that closed loop communication to make sure that we don't have any errors. If you find any discrepancy during this verification process, immediately stop, double check that there is in fact a discrepancy with your buddy. If there is, you need to return that blood to blood bank. Do not administer it to your patient. When you're ready to initiate your blood transfusion, you need to prime your IV tubing with normal saline before you spike the blood product. The red blood cells in your blood are pretty sticky, and if you don't coat that tubing with normal saline prior to, they can actually catch on the edges of the tubing, and it can cause those red blood cells to burst. The RN has to be the one to spike the blood product. The blood product must be hung within 30 minutes after leaving the lab. You need to prime the blood to the hub before you attach it to the IV site. Monitoring guidelines during a transfusion. The RN has to remain in the room or within close proximity of the patient until the blood is infusing into the IV device. The RN or the LPN then needs to remain with or in close proximity to observe the patient for at least the first 15 minutes of the transfusion. Most transfusion reactions are going to occur within that first 15 minutes. From there, the RN, the LPN, or the MD must be the ones to take the 15-minute vital signs. So your vital sign checks are 30 minutes before, 15 minutes after you start, 1 hour after the start time, and then after the transfusion is done. CNAs, USAs, ED techs, and paramedics are able to get the blood vital signs for all of them except that 15-minute check. That has to be the RN, LPN, or MD. To reiterate, vital signs must be obtained 15 minutes after the start of the transfusion by the RN, LPN, or physician, then again 1 hour after the start of the transfusion, and immediately post-transfusion. You also want to take vital signs PRN as the patient condition warrants. There is no hard policy on rate of infusion. For your adult patients, you want to regulate to infuse slowly for the first 15 minutes. Your suggested infusion rate during this 15-minute time frame is 50 to 75 milliliters per hour. This is because, again, most transfusion reactions occur in the first 15 minutes. The more blood the patient gets before the reaction occurs, the worse the reaction generally is. If you have not seen a transfusion reaction after the first 15 minutes, you can increase that rate depending on the patient's blood volume, cardiac status, and hemodynamic condition. Per central policy, the rate of transfusions for non-emergent settings are as follows. For red blood cells, your adults will get them at 150 to 300 milliliters per hour. Pediatric is going to be 2 to 5 milliliters per kilogram per hour. Plasma for adult patients is 200 to 300 milliliters per hour. Pediatric is 60 to 120 milliliters per hour. Platelets in adults are 200 to 300 milliliters per hour, and pediatric are 60 to 120 milliliters per hour. Cryoprecipitate should be given as rapidly as tolerated. So these ranges are open to your discretion. If you have a patient who's 95 years old with CHF and teeny tiny veins you could barely get a 22 into, you don't want to try to run that at 300 milliliters per hour. You want to go for the lower end. So use your discretion when determining the rate of your transfusions in non-emergent settings. Some more things to keep in mind. Transfusions must be completed in less than 4 hours. So from the time that you hit start to the end of that transfusion must be less than 4 hours. So when you're determining what rate to run your transfusion at, keep that in mind. When the transfusion is complete, you're going to discard the blood administration set in the red waste receptacles. You're going to monitor the patient for 30 to 60 minutes post-transfusion. When you're documenting blood administration, both the RN or MD starting and the RN, MD, or LPN verifying the transfusion must co-sign in the electronic medical record. You need to record each set of vital signs in the EMR, document the amount of blood transfused, and then the RN, LPN, or MD discontinuing the blood product must sign in the EMR. So the slides after this one are going to get into some screenshots from Bridge. It's not going to make a whole lot of sense to you until you actually get into the program on the floor, but this at least gives you a little bit of an introduction to it. So first off, the paper document that comes with the blood product does not need to be returned to the blood bank post-transfusion, but this is that document that must remain attached to the unit throughout the transfusion. The only time the paper document accompanying the blood product needs to be returned to the blood bank is if you are in downtime and documenting the transfusion on that form. In that case, the paper record is your method of documentation and needs to be returned to the blood bank for review. Blood bank staff will scan the document into the patient's chart once their review is complete. Your patient identification, blood product identification, and transfusion information will be documented in the EMR using barcoding technology. So you are going to scan all of that information in as you're verifying it.